The Umesh Method is a gentle, evidence-based system designed for somatic awareness and nervous system healing. It focuses on 4 core pillars: integrated practice, consistency, listening to body signals, and universal access for all ages, requiring no equipment. This video introduces the Umesh Daily Exercise Method, which blends yoga, physical therapy, meditation, micro-movements, walking, and healing dance. The core philosophy is that small, frequent movements create profound, lasting change. The method integrates multiple movement modalities. These include yoga flow for strength, physical therapy for alignment, meditation for stillness, the 200 times micro-movement method, gait training, and rhythmic healing dance. Part 1 of our program covers the philosophy of listening. It highlights the core truth that our bodies signal distress long before burnout, and outlines 7 principles including listening early, moving gently, and respecting pain as vital information. Part 2 focuses on gentle movement foundations. This includes foundational yoga poses and physical therapy techniques for neck, shoulders, spine, hips, and full body alignment, emphasizing micro-corrections for long-term health. Part 3 presents our signature methods. This covers the 200 times micro-movement method to lubricate joints and breath hold poses to cultivate deep stillness, helping to reset the nervous system. Part 4 explores flow and awareness. It introduces rhythmic dance to restore vitality and structured meditation practices that begin internally, focusing on breath preparation and listening to bodily sensations. The final part focuses on integration and legacy. We cover daily routine suggestions ranging from 5 to 45 minutes, emphasizing the core message. Breath is the language, movement is the dialogue, and listening is the transformation. The Umesh Method emphasizes mindful movement and somatic awareness, as demonstrated here by gentle, rhythmic hand and arm motions that connect the practitioner to their inner state. In Chapter 1, we address the philosophy of healing through conversation. We explore the problem of ignoring body signals and provide the solution of daily, deliberate check-ins to prevent chronic issues. Our holistic system blends yoga, physical therapy, micro-movements, and dance. This guide helps you shift focus from intensity to consistency, ensuring a sustainable, lifelong practice built on softness rather than force. Chapter 2 details our first 2 principles: listen early and move gently. These principles encourage paying attention to early signs of fatigue and utilizing repetitive, gentle movements to maintain joint health. We continue with principles 4 through 6, respecting pain as communication, recognizing that stillness is a form of medicine, and understanding that healing is rhythmic rather than linear. The final principle is that the body is always moving toward healing. We learn to honor natural rhythms rather than forcing results, trusting the body's innate wisdom to guide the recovery process. Chapter 3 focuses on foundational yoga and stillness. We learn that this practice isn't about physical flexibility, but rather using gentle, breath-regulated movements to steady the mind and regulate the nervous system. These foundational poses are sequenced to gently mobilize the body, transitioning from standing alignment to spinal flexibility and hip opening. The first pose is the forward bend, or Uttanasana. It aims to lengthen the spine, relax your nervous system, and gently stretch your hamstrings and calves. To practice, stand with feet hip-width apart and soft knees. Inhale to lengthen your spine, then exhale fully to fold forward from your hips. Relax your neck and hold for 20 to 30 seconds. For the breathing method, take 5 to 10 long breaths while standing tall. On your final exhale, fold forward and hold the breath with empty lungs for 20 to 30 seconds. Next, we move to the mountain pose and cat-cow. The mountain pose, or Tadasana, is excellent for improving posture, grounding, and balance. For mountain pose, stand tall with feet together or hip-width apart, distributing weight evenly. Relax your shoulders, inhale deeply, and exhale slowly while holding the position for steady grounding. Cat-cow mobilizes the spine and warms the joints. Begin on your hands and knees. Inhale to arch your back for cow pose, and exhale to round your spine for cat pose. Continue moving slowly and smoothly through these cycles for 20 to 30 seconds. Pro tip: focus on the sensation of breath flowing along your spine to maximize neurological benefits. Our next sequence includes child's pose and downward dog. Child's pose is a restorative posture perfect for calming the mind and releasing tension in the back. Kneel on the floor, toes touching, and sit back on your heels. Fold forward, resting your forehead on the ground, and hold the position for 20 to 30 seconds. Downward dog strengthens the arms and legs while energizing the body. From hands and knees, exhale and lift your hips into an inverted V, pressing your hands firmly into the ground. Let your head hang naturally between your arms and hold for 20 to 30 seconds. Transition slowly between these poses to maintain your breath rhythm and focus on your lower back. The sequence continues with Cobra and Bridge poses. Cobra pose strengthens the back and opens the chest, while Bridge pose engages the glutes, hamstrings, and lower back. For Cobra, lie on your stomach and gently lift your chest while keeping elbows slightly bent. For Bridge, lie on your back, knees bent, and lift your hips toward the ceiling. Hold each of these for 20 to 30 seconds. Always remember to lengthen your spine throughout to avoid compression, keeping your breath steady and controlled. This video presents the 15 joint repetition exercises of the Umesh Method. This systematic approach addresses all major joint areas of the body, starting with the neck and shoulders, to provide comprehensive daily movement. We begin with the neck, performing micro neck nods, micro neck turns, and micro eardrops. These movements are designed to be repeated in sets of 25 to 50, aiming for a total of 200 repetitions per movement. The micro neck nod involves a tiny up and down yes motion. Its purpose is to improve mobility and reduce stiffness while calming the nervous system. Keep it soft, smooth, and rhythmic. For the micro neck turn, rotate your head a few millimeters left and right. This improves cervical rotation and increases blood flow to the area. Maintain a level chin and move slowly. The micro eardrop involves tilting your head toward each shoulder. This releases tension in the lateral neck muscles and improves mobility, which is especially helpful for improving driving visibility. Moving to the shoulders and arms, we perform micro shoulder shrugs, micro elbow bends, and micro wrist pulses. These movements loosen joints and reduce tension from daily activities like typing. Micro shoulder shrugs involve lifting the shoulders just a few millimeters and lowering them gently. This is excellent for posture reset and managing symptoms of frozen shoulder. Micro elbow bends focus on improving elbow mobility and reducing arm fatigue. Bend and straighten the joint just a few millimeters, keeping the motion tiny, smooth, and rhythmic. For micro wrist pulses, extend your arm and gently move the wrist up and down. This targets carpal tunnel tension and forearm tightness, providing relief through soothing, repetitive motion. Next, we address the spine with the micro spinal wave, micro chest lift, and micro pelvic rock. These movements gently mobilize the central structure and improve overall posture. The microspinal wave involves tiny ripples of the chest and upper back. This is not about stretching, but about mobilizing the spine in a fluid, gentle manner. Micro chest lifts work by lifting the chest upward a few millimeters to activate postural muscles. This is a highly effective way to reverse slouching and open the thoracic area. Micro pelvic rocks and micro hip shifts lubricate the lower back and hip joints. These movements improve pelvic alignment and gait, which are essential for long-term mobility. Finally, we conclude with full body integration using micro knee bends, micro ankle pumps, toe taps, and the micro whole body bounce to ensure full body lubrication and circulation. Remember that the goal for all 15 exercises is 50 to 200 repetitions. Consistent, tiny rhythmic movements are the secret to deep recovery, joint health, and a calm, centered nervous system.